Hi, Dr. Joe Brown, and thank you for joining the podcast.
My pleasure. I'm excited.
So, can you tell us about your background?
I have a unique background. I guess I started off in doing a little bit of strength and conditioning and then became a physio. And then once I became a physio, I realized that performance was more than physical. So I ended up studying more coaching, NLP, and sports psychology. So I now look at performance and injury from a completely different mindset. And I look at both performance and injury starting and ending from performance. So quite different to the average physiotherapist.
Okay, so you studied kinesiology and then physical therapy, right?
Yes, yes. From your perspective, yeah, in Italy.
Right. Yeah, usually. And did you do any other studies or PhD or could be certifications that were really important for you for your career?
Like so many different certifications and courses. I definitely learning is one of my primary strengths. So I definitely followed knowing that learning and knowledge helps you achieve. But I think the big thing a lot of people don't realize is you can learn something, but you need to be able to process it and be able to analyze it to be able to actually make a difference with the knowledge. And knowledge in itself is not power,
Mm,
it's the
sure.
actual use of knowledge. So, yes, I encourage people to that want to have a career in high performance sport to learn from everyone they possibly can. One course or one philosophy is not going to guide you to be the best practitioner you can be. It's really taking all that information and using that information in practice and figuring out what works best for you.
Mm, sure. Learning by doing, and most of all, working and dealing with athletes, in this case, is going to help you much more than just studying, for sure.
Yeah.
I had the pleasure to meet you at a course in May here in Milan, close to the place where I am here in Italy. And you were talking about slings and fascia, most of all. Would you tell us more about this and just a summary about like this concept?
Oh my gosh,
I,
huge
I
topic.
know I know it's difficult, but yeah.
We've only got one podcast. Simplest way for people. I utilize slings and fascia when I work with athletes. Most of the time, an athlete will be primarily fascial dominant in the way that they utilize muscle and create force. So they'll be primarily muscular dominant. So someone who is generally a little bit leaner, lighter in their body type is more likely to be fascia. So Noah, for instance, is very much a fascial based athlete. So with him identifying that allowed us to really work with his sling. So work his body muscles that are grouped together in slings in order to create muscles. So he doesn't need to be necessarily as big in his muscles to create force as someone who's more of a muscular athlete.
Mm,
So, and the way I use slings is really to try and get the best out of every athlete. So, even if you're a muscular athlete, you're still going to use your slings, and it's looking at which slings are deficient. So, your slings might be deficient, it might show up in static position, it might show up in dynamic position, it might show up in strength testing. And it most of the time will show up really clearly in how they move, particularly when we look at high speed
mm,
sprinting.
mm. So, as you said, you have been working with Noah Lyles for how many years?
Nearly three, I think.
Okay. And for example, how was the your work structure with him? How many times did you see throughout the year, and which was like the time span of the usually how long have you been working together, and how was a typical day together?
Okay, so it was one of those situations where I don't think neither Noah or I knew how the relationship was going to 100% work. So what the plan was and how it ended up working out was um, just based on the skill set that I had. So I started off just being his physio that was going to travel with him when he needed someone when he was traveling. And then when we were traveling, it became obvious to him that I had, a larger skill set that he could use outside physiotherapy. So from a biomechanics perspective and actually changing performance. And then that started us down a different path of him wanting me in his home training environment as much as possible. So spent a lot of time. I don't know how many days exactly or months or weeks a year I spent with him. I know it was a lot. I feel like I've spent more time with Noah than anyone else in the last 3 years. Definitely more time with Noah than my husband, I can tell you that much. But it essentially just became on demand. So, excuse me, I do a lot of the traveling with him to the bigger events and the events where there wasn't going to be necessarily the appropriate people with him. And then spending, 6 weeks at a time in his home training environment, particularly at certain times in the season. So very much start of the season. And again, when he's starting to run really fast, around April. And then obviously that lead in to the big events, June, July. So when you look at that throughout the year, it ends up being quite a lot of time. And then a general day, I pretty much follow Noah's days. So in a normal training environment day, it's getting up, meeting him at the track, doing generally there'll be some kind of treatment mobilization based on a niggle that's going on, go through activation, warm-up process, and the whole time adjusting with him on the table. So it might be that he's having an ankle niggle or a foot niggle, and then we'll work on that, make sure we're cleaning that up before he really gets into drills. So then that's 8 a.m. till maybe 12 to 1 at the track, and then go straight to the gym, and then a couple of hours in the gym, and then gym to treatment and recovery, and then the day starts again the next day. So it's very easy when you're a professional athlete to fill in a day, and most people don't understand how the day goes so quickly, but when you're spending that much time in training and then the time to do the recovery and the treatment, it's very easy for it to be 6 o'clock before you thought about what's going to happen next.
So every day there was treatment, as you said, and you could implement on a daily basis as well, some movement prep, for example. Okay.
Every day. So the more I got to know and understand Noah's body, the less treatment we did, and more activation, more body prep stuff. So, and I think that's a really important statement to make, because I think some people, when they work with high-level athletes, think they need to treat them just for the sake of treating them, rather than what their body actually is going to respond to. So we can over-treat as well. So just being conscious of what we're trying to actually achieve in each of those times.
Yeah, I mean, I guess it has been a great journey with him, even if it was like you spend a lot of time, as you said, but I think it's always worth it when it comes to dealing with these athletes. I asked you, I think some months ago, which was the biggest takeaway, I mean, learning dealing with an Olympic champion. So would you tell us one or two things that maybe you can take away from this beautiful journey?
Oh my God, there's so many things. Gosh, I think the power of really having a good relationship and a good connection with someone and working on that relationship, I think, is so important. The power of trust in that. So there's so many things that I was able to achieve with Noah because he trusted me. So there's a lot of things that I initiated, asked him to do differently, especially in the process of changing some of his biomechanics things. And what happened was he was, excuse me, having some, and everyone knows Noah's never been a great starter, right? So we had to look at what we could do to change that. So where we could have impact, and a lot of that impact was in around his foot biomechanics and his foot stiffness. But in order to do that, we changed other things at the pelvis, and that takes a lot of trust to really be starting to change biomechanics and change how someone moves. And Noah has lots of other great people that work with him. He works closely with Ralph Mann to help those things, but a lot of things I was trying to achieve with him were implementing that and changing that on a daily basis. So you cannot have enough trust and a relationship. And then the other side of it is the best people in the world are learners. The best people in the world want to learn every day. So if you've got an athlete that you're working with and they say they want to be the best, you really need to challenge them on that. And they need to get better every day, and so do you. And they talk about that 1% every day thing. And if you really think about it, if you're getting better 1% every day, you're going to be the best in the world for sure. But even if you don't achieve 1%, if you achieve a little bit better every day, and that's what your goal is, I think that's huge.
So have you been working with other sports, other athletes in other sports before him?
Excuse me, I'm recovering from that cold. Yes, I've worked with, it's 19 different sports, I think, for 7 countries now. So I've done a lot, seen a lot. And every sport I've worked with, I have been very mindful that I can learn from each of these opportunities. So I believe I'm one of the best in the world at what I do because I've had all these different experiences. I'm better because I didn't stay in football or rugby or any of those sports. I really have made an effort to observe movement and observe how people respond to different treatment and different exercises in different sports. So most recently, I probably had more of a basketball focus outside in track and field. I really love basketball. I love it on lots of levels. I love that they move in so many different planes of movement. I love the acceleration components of it. And I always, every sport that I work with, look at it from the perspective, okay, what can I change here? So for the athlete, how can I change performance? Can I change the way they move? Can I change the way they accelerate, decelerate? Can I change the way they jump? All those types of things. So I really love basketball for that. The other thing about basketball I find is, in terms of sport as generally amongst athletes, is that they don't have good transference. So what they do in the gym, for instance, doesn't transfer well back into their performance environment. And I think we can get a whole lot better using sports science to really do that better for the basketball athletes. But I also work with individual football players and lots of different sports, different levels, but I'm more consulting to teams and individual athletes rather than working and staying within one team right now.
Yeah, so I love both sports, so track and field and basketball. And whenever you talk about one of those, I'm really like, my eyes are opening, and yeah, it's always good dealing with these athletes. You said which other sports besides football? Because you mentioned about other experiences with other countries. Can you tell us, not do a complete list, but maybe just
like beach volleyball. So I've worked quite a bit with beach volleyball lately. So obviously it's a jumping based sport. Gosh, alpine skiing, snowboarding, aerial skiing, ice skating, rugby, netball, basketball, cricket, soccer. Oh, I'm getting badminton, tennis, squash, bobsleigh, Jamaican bobsleigh. Gosh, yeah, a lot.
tons. Um, so going back to before you started to study and deciding to follow the physical therapist work, why did you choose that? Did you practice sports yourself? Because usually the typical path is that maybe we try to do sports and then we encounter injuries and then we try to help other people to stay away from them.
Yeah, look, I did I was a swimmer and did surf life saving. So obviously upperland based sports from New Zealand. So that's where I started. I actually had some injuries as well. I had a nerve traction injury coming off a surf ski and really injured my shoulder and my neck at a young age. So, and that was a pretty horrible injury to come back from. I also had I also did a bit of running and had some bad ankle injuries. And I remember going to the physio and being so amazed about his knowledge and that he was, going to fix me. And this was pre I'm old, so this is pre, exercise and rehab. Like you used to go in, they'd put a machine on you, ultrasound, all those things. So, but I was fascinated by this man's knowledge. Retrospectively, he probably wasn't that good at what he did, but he still, encouraged me to become a physio. And I knew I wanted to work in the medical field, but I didn't actually want to deal with sick people. So, and then I realized that in order to do sports medicine, you had to do normal medicine first, and I just decided it was too long, so went straight to physical physiotherapy. And I think the thing about physiotherapy or physical therapy is we have this great grounding in base sciences, and then we can really choose what we do with it. And I think we're in a really powerful time right now that we need to really claim what we do as physical therapists, and we need to start being better at what we do. I really think that, and I don't know exactly how it is in Italy, but my experiences in different places globally is that other people were, coming in and taking some of the physical therapy pie. And I think unless physical therapists really stand up and unite about what it is that they do and share it with the world, there's going to be other professions taking over.
So, how much do you value the the great cook and boil concept about joint by joint approach? Like, because that was something that fascinated me when I started functional training first. And how much do you implement that? Because I'm gonna ask you this. I'm not a physical therapist expert. I'm just graduating in kinesiology, but I think even when we train people, it's important to think about this and the joint by joint approach. So, do you want to tell us about this?
But I think there's two ways of looking at, well, there's more than two ways. There's a million different ways to look at every athlete. I'm very biased towards movement. So looking at how someone functionally moved. And when I say movement, it's about the quality of that movement. What do they use to move? Is there a good sequence to how they move? Is there certain, like you're saying, joints that are moving well and some that are moving not so well? So where is that dysfunction within the system? I think you need to be able to do two approaches. So I think you need to be able to look joint by joint and break it down how you're moving each segment, but you also need to look at the overall movement, because sometimes the cueing and what is going on for that person is just actually something we need to change from the nervous system side. So by just giving them one cue to say, it could just be, okay, I don't want you to do that again, take a deep breath and now move, and just think about staying relaxed as you move, might change the overall movement, and you haven't actually done anything for each individual segment. So I think it's been able to do both from a movement perspective, but also from any analysis perspective, but nothing moves in isolation. So if we do a squat, there's no point just following what's happening at the knee. Most of the time things get missed because people aren't looking at the hip.
Sure. So in this podcast, we have physiotherapists as well that listen to us, besides sports science and other fields. And would you tell, for example, them which are the things that you learned during your career that maybe you have been doing in a way in the past, and now you completely changed, and something that really changed your approach?
I guess the biggest overall theme is when I graduated, obviously we were taught very much, and from the physical therapy realm, that there's a recipe for everything. And the reality is there's no recipes. We get taught recipes just so we've got some kind of guideline when we leave practice. So in the real world, recipes don't work. We also get taught that things happen in isolation, that there's one structure at the root cause of most of our injuries. And in reality, there's normally multiple structures at play and multiple joints at play. And it's an overall dysfunction, very often based around movement. So if we can understand how they move, then we can understand the dysfunction, where force is going, and then what structures might be affected by that force. So to summarize, gone from one joint, one structure to all the joints, all the structures, thinking about force and movement rather than just structures. Not to say that knowing pathological structures are involved are unimportant, but there's a reason why that structure was the pathological structure. So I had a girl recently came to me after, I think she'd been seeing someone for 6 or 12 months with medial knee pain, and she had a stress fracture in her medial facet, so the corner of her kneecap of her patella. And she'd had a fall on it, but one fall is not going to cause a stress fracture, right? So there's a reason why she was taking force in that part of her knee. And then so I looked at her biomechanics. She had a heavily pronated foot. Her hip was internally rotated. So all the force was going down that medial pillar. Like you'd almost see where that force was going into her patella. So of course, if that's her mechanics statically, and then you watch her run, the same thing's happening. So as soon as her center of mass lowers, that's the line of force that's going to hit the ground first. So she's hit that exact place in her knee when she's been playing rugby every single time. And as soon as we changed her biomechanics, then she no longer was falling on that part of the knee again. But if I'd been looking at the structure, so earlier in my career and what I was taught was focus on that one structure. So let's do whatever we think we're going to do to help with bone healing. And to be honest, a lot of the things we do aren't really going to help with bone healing, but we can change the load that's going to that structure.
So what, because I had I want to say a bad experience because I still practice sports myself, and I've been dealing with a physical therapist, and I really esteem all of you because I feel that is so much important. And I had to deal with one physio that is actually osteopath. I don't know if it's common in okay.
Yeah.
But his approach was like, okay, I don't have to listen to whatever is your background, and I don't have to watch you and everything. I just watch you standing. And basically he was saying he's gonna do his treatment that was even short, and that's it. And he didn't need to know anything more about everything else. Well, what do you think about this approach? Because I think it's really different than what you have been telling us.
Yeah. I don't think you can. So it's, you can get baseline results. So he could probably see you in standing and see one thing that he could change to make you 1%, 5%, 10% better, right? So with every athlete that walks through my door, I can normally watch them move, have an idea of some of the dysfunction going on within their body and some things that I could change easily, right? So there's always what we call in Australia is low-hanging fruit, right? So there's always something that you can grab for a little bit of gain really easy. It's the same in the gym. But to really get a complete understanding, and particularly when you're working with higher level athletes, so their skill level, their dysfunction is so much harder to detect and determine, but the forces they're creating are so much greater. So you have to be so much better in order to detect those differences and dysfunctions to be able to make a difference, because it's like the same thing as when someone's trying to lose weight. When you got 30 kilos to lose, you can kind of just move a bit better and you're going to start to lose weight and, stop eating chocolate. But when you're trying to get to 3.8% body fat, you've got to be a little bit more stringent with your diet. So I think you can make change, but he's missing a whole lot of things by that.
Yeah. Can you tell us about any book that you found really interesting for your career and even like other topics? So maybe just 3 books that change your perspective.
Oh, there's so many. Oh my God, and now you got my brain trying to think the names of them. There's a couple of really great books that I really love about the biomechanics of movement and the biomechanics of sprinting. And I can see the front cover. It's got a man running on the front and a blue cover, but I can't.
Okay.
My God. So that I really love a lot of the philosophical thinkers and the people that people like Tim Grover that have done some really great things in basketball, and just his attitude to what he brings and how he holds himself within the high performance environment. So I think there's a balance of things that we read for us learning, and then about what we do and how we talk and work with athletes, and these things that we read to learn about ourselves. I guess I'm in a phase in my career that most of the books I read these days are actually learning about how I can be better, and rather than learning the science and the mechanics of that, because my education on that is still constantly evolving. But I really like Adam Grant, Think Again. So just challenging the way that I think is probably more of the reading that I've done. I've actually got a book coming out myself. It's out in January in Australia, and I think it's in Europe in March.
Okay, nice. What would
So
be the name?
It's called See Your Elephant, Discover What's Holding You Back from Your True Potential. But if you look up Dr. Joe Brown, See Your Elephant, it'll come up.
Okay. Congrats.
But because thank you, because I've written that book, and it's essentially the idea that there's not just an elephant in the room, and I don't know whether you know that term in Europe, but basically we all have elephants. So we all have things that our blind spots, the things we choose to not look at, our BS, I'll say bullshit, but BS, the things that we, choose to ignore, push away, and they stand between us and our true potential. So many athletes come to me and they're like, Joe, I know I'm a 9.9 runner, but I just can't do it. I can't reach my potential. I'm doing everything. What's going on? And there's normally an elephant standing between them and their best potential. And they're things that are a lot of it's around our psychology and our blind spots, the things we're not doing in and around our training. And some of it is that, you've been with the coach for so long that they're no longer the best fit for you as a coach, or you've got a physical injury that is still impacting you, but you're pretending you're okay when biomechanically you're still not moving well. It's comparing yourself to someone else. There's 14 different elephants I talk about, and I talk about stories of other elite athletes. So all stories that most people would know from the highest level. And obviously my own experiences with Noah and Johan Blake and people like that.
Okay, great. So you mentioned about plans for next year. Do you have any appointment or any other projects that you're working on?
So I'm here in the US right now and working on a few projects with a few different people. A few of them I've signed NDAs, so I can't be exactly clear, but some stuff around the very much the cutting edge of sports science right now, and the integration delivery of sports science at the highest level. So in some talks around that and some consulting there. And then I've seen consulting with athletes. In terms of track and field, most of the athletes I've been working with are taking a little bit of a slow start to 2025. So meeting with a few that didn't go to Paris at the moment, and then others, obviously, they'll have a bit of a slower intro into 25. And then obviously it's a long way back to 28. And then still a bit of work consulting with players and teams within the NBA as well. So those are the kind of things I'm juggling at the moment, but you never know where the next opportunity comes. So a lot of the things with me are very last minute. I get called up to go and impact a certain situation for a player or a team. So it's not all quite predictable for me. It's not like because I act as a consultant, so I don't go and work with one team for the next 3 years. It's kind of not how I roll. Unless it was a team that I really want to work with, then I'd consider it.
We'll see. So again, for the listeners, because I think you shared with us, again, an amazing journey, and somebody is looking up to you. So what would you tell to a young physical therapist or a student that is just going through all the new journey and would like to work with sports and athletes? What would you tell him or her just to follow the right path, or just to make it easier? Even if it's not, I know, but like some tips.
Yeah, I mentor, sorry, a lot of like physiotherapists from around the world. And it's interesting, wherever you come from around the world, if you're a physical therapist or a physiotherapist, there's a really similar personality type. So most of you out there are pretty keen learners and just want to be the best as soon as you can. But it all starts with really knowing who you are as a person. I know this sounds airy fairy and like, how can that really help me be a great physical therapist? But when you get really clear on who you want to be as a physical therapist, so even if you just can think about 3 words that you want to be described as, if someone says they're a physical therapist, well, that's what they did for our team. That's a really great place to start, because then you start showing up as that for all your interviews for all your athletes. And I think it can be really hard sometimes because, like you said, there's all these courses and all this information, and you're just trying to take it all in, and you can lose your own track. And there's no point trying to reproduce another physio. You need to get really clear on what your strengths and weaknesses are and how you want to show up in all your practice. And I think you can learn a lot of information, but you also need to take time to synthesize it. So really learn how to utilize that information.
Mm.
And just like with athletes, everyone's good is, we all have this rocket ship to success and we all just want to get on the rocket ship. But the most important part is building the foundation. So early in your career, it's really about building that foundation. And that's like getting the experience, going and do the courses. But the thing that people don't think about is building the relationships. So most of the people that make it to the top have got really good relationships with people over long periods of time. It's not just send, and especially today, like it's literally, if you're having to send in your CV for the top jobs, the job's already gone. You need to have had a communication with those people. And I know because I have now gone on to the other side of that, whereas I used to send my CV, but now I get an email or a LinkedIn message saying, hey, Joe, this job's coming up. Do you want to apply? So relationships are super important.
There's always this, for most of all in Italy, um, we underestimate how much relationships are important, and we usually try, if we are not that proactive type of person, we say, okay, but you have good connections, so you can go to that place or whatever. But actually, you must build connections in a good way, and you must show how much you value and who you are as a person, as a professionist, and then you don't have to be ashamed if you have good connections that brings you to the place where you want to work in. But yeah, still, it's something that in some places you have to work on.
Yeah, 100%. And I just think it's so underestimated. And I think we're going to go more and more into that space. I think that's where sports medicine, sports science, sports performance, all is going to lead us into a point that it's going to be about the relationships.
Okay. Thank you so much, Dr. Joe Brown. It was a pleasure again to talk with you, and hopefully we see in the future somewhere. I'm trying to go to, for sure I want to go to the Olympics, not as an athlete, but as a tourist as well. We'll see what's going on. But again, thank you for your time.
Winter Olympics are going to be in Italy 26, right? So
Yeah.
I think I'll be there with the Jamaican bobsleigh again. So I'll let you know.
Okay.
Maybe I can run a seminar.
Yeah, would be nice. Maybe I have people that would like really to have you as a guest. So we'll see. Okay.
Awesome.
Okay. Thank you so much.
Thank you.